Finding employment can be difficult for many people, including those with barriers like substance use disorder or mental health diagnoses. Building Evidence on Employment Strategies, or BEES, is a study of innovative programs designed to boost employment and earnings among people with low incomes.
The BEES project is funded by OPRE, Administration for Children and Families, and the U.S. Social Security Administration.
BEES is a large-scale evaluation and learning project.
Megan Reed, former BEES Federal Project Officer, Office of Planning, Research, and Evaluation in the Administration for Children and Families.
And that's really intended to help inform the Administration for Children and Families about promising interventions for employment strategies for people with low incomes who may experience a range of barriers to employment. The project primarily focuses on populations of people with substance use disorders and behavioral health conditions.
We're working with folks with a lot of chaotic life circumstances.
Christopher Noper, Director of Participant Services, Impact Behavioral Health Partners, Illinois.
They got kids or they got elderly parents that need care often, or they can't leave them alone for too long. They need to get their GED. They have transportation issues where there's only certain places they can get to. Those are a lot of challenges that the employment specialists are working on all the time.
MDRC is leading the BEES study.
Megan Malenke, BEES Project Director, MDRC.
And then we are working with both MEF Associates and APT Global as research partners on it. And then in addition to a whole host of programs that are involved.
BEES is conducting 13 studies of various designs at 19 different programs across 13 states. BEES studies assess whether the program improved employment rates for participants, explore how programs operated, and document participants' experiences, among other things. Programs in BEES support people with substance use disorder and/or behavioral health diagnoses, and those receiving public benefits like TANF and SNAP, among others.
The way that I view
Melissa Chavez, LCPC Employment Program Manager, Impact Behavioral Health Partners, Illinois.
just the overall impact of our services. Some folks have never been asked that question of, what do you want to do? What do you see yourself in the next couple of years? A lot of our folks are focused on having food on the table, having housing, having transportation. They're not able to look outside of the scope of the immediate need, whereas we're able to get them into a stable employment situation, I'll help them look beyond that.
I work with the
Al Marquita, Employment Specialist, Impact Behavioral Health Partners, Illinois.
Participant, and then we work together in terms of finding them job. Let's say they emphasize that they want to work for a data entry job. I will have to go to speak with those employers to understand in terms of hiring process and to know the obstacles that individuals are able to overcome. And the job is their choice, whatever field they want to work in. They pick that one, and we go from there.
I'd say the biggest barrier
Thomas Naylor, Employment Specialist, ZEP Center, Ohio.
To employment in Toledo is transportation. I think the second one is dealing with a criminal record. So what I do is I do a lot of geographic mapping. So what it took with a lot of me doing is just concentrating those jobs that are within walking distance.
I go out into the community.
Cara Bragg, Employment Specialist, Core Health, Washington.
Build rapport with hiring managers. So it's been tough. In our community specifically, people are super busy and don't really want to hear you out. So I think just that consistency and showing them that you're going to keep coming back no matter what. So then they'll have to listen to you eventually.
Meeting with employers.
Christina Gagnon, Supervisor, Core Health, Washington.
We just love learning about what they do, how they hire, what they're looking for, what makes a person stand out to them. And so we can get a lot of that feedback and just kind of share it with the people we're supporting and that we're kind of trying to make those good job matches, because it is important to us. We want to see people stay long-term employed for a long time. I want them to feel like they are doing something that feeds their soul in a way, and because that's really what makes people excited to go to work.
You know, people in recovery.
Dustin Bailey, Associate Director, Grand Addiction Recovery Center, Oklahoma.
If they're engaging in recovery, they are living intentionally with integrity and being honest and being willing to do whatever is necessary to take care of whatever needs to be taken care of. And those skills translate really well into the workplace. So as we've been able to place more clients into different positions, we've noticed an increase in just the willingness to have a discussion with our people and then ultimately hire our people.
In summer of 2024,
Bees Summer Swarm, June 2024.
staff participating in the Bees Project convened in New York City for the Summer Swarm to share lessons and collaborate with other programs across different states. This was also an opportunity for staff to engage in peer learning around participating in the Bees Random Assignment Studies. The event was hosted and facilitated by MDRC and their partners MEF Associates and APT Global.
Being at the Summer Swarm with all of the different organizations and different people that are having different ways of kind of going about their service delivery, it's very exciting to meet them and to hear a little bit about how they do things and learning about different ways to support individuals, whether it be service delivery, employer contacts, or just talking to them and finding out what's important to the people that they're serving.
Sarah Tucci, Lead Employment Specialist, Impact Behavioral Health Partners, Illinois.
There were similar challenges that we face and that other studies have faced as well. And then, of course, there was also different challenges between the different states. So it was interesting to hear that, like, okay, they're struggling with that barrier, but on our side, that's not much of a barrier.
I think there's often interest when we're out in the field talking to them about what other programs are doing as well. And giving folks an opportunity to learn from each other is amazing, but also for an opportunity for us as researchers to learn from what they're doing in the field and what they're hearing and feeling and thinking as well.
I think one of the things we've learned throughout this evaluation already is how passionate programs and their practitioners within those programs are about helping people and about really partnering with us to help learn what's most effective about their programs, how can it be better implemented, what are the successes and challenges in implementing programs like this.
The Bees Project has released a number of materials already and will continue sharing research findings that may inform policy and practice. Abigail Valdez, Research Coordinator, Impact Behavioral Health Partners, Illinois.
I've always been very passionate about research, so finding this little pocket of research where we're able to study intervention has been amazing. I think that we have learned some techniques in some spaces that things work and or don't work. I'm excited that this project can inform potential policy or about maybe bringing more of these services into our community.
A lot of Americans experience barriers and challenges with finding employment, staying employed, and earning enough wages to support themselves and their families. So we are really interested in building the evidence base that the Administration for Children and Families and hopefully other entities can use in order to build evidence that can help inform moving the needle and funding programs that really will help people who experience these challenges, which really could be any of us at any time.
The Bees Project is ongoing and is funded by OPRE, Administration for Children and Families, and the U.S. Social Security Administration. The Bees Project is being conducted by MDRC, ABT, and MEF Associates. To learn more, visit cf.gov/OPRE and mdrc.org/BES. MDRC, Building Knowledge to Improve Social Policy.